doing so well. In fact, the travel to space will become a reality very, very soon, much sooner than you think. And you know why they're so successful? They figured
Why?
out the market for people who are willing to pay $100,000 or $200,000 or maybe
Okay.
even a million or two to
Yeah.
travel. And they
Right.
figured out that there are thousands of people on Earth who accumulated fortunes of $1 billion and several $1 billion, and these people will never be able to spend their money in their
Right.
lifetime.
There's
So
more
these
billionaires than
people, for
there are
them, it
billionaires.
just doesn't matter whether they pay
Sure. I know.
$100,000 or $1 million or
I,
$10 million. Just
you know,
doesn't matter.
I totally understand that. In other words, the thing is, they become very price insensitive, but they're still sensitive to prices. So in other words, but the thing is, you're looking for value. In other words, like even when I look at first class, I have to compare it with business class because there isn't that much differential. But the pricing between first class and business class can be
Yeah.
astronomical. So all the people that I know that are successful and they have a lot of money, they still look for value. And 5-star, yeah, I can get away with a 4-star hotel with a suite, depending on what the pricing is. So you still, no matter what, look at the price of everything that's out there. But I also will tell you that if you travel and you stay in the 4-star, 5-star hotels and travel first class, it's a whole different experience than if you travel with a backpack in a hostel, which I did in my college days. Okay, that's a whole different experience. And the problem is my wife doesn't like traveling that way. So guess what? We travel a different way, and that's the realities of the world.
Yeah, but I'll tell you, I think some jails are better than hostels because in jails,
Better.
so you can learn languages or take university course and do something meaningful, play table tennis perhaps. But in jail, yeah, it's not so bad.
Yeah,
On
well,
the
I want to
other
stay
hand,
away
in
from jail.
hostel, I don't know what you can do in hostel.
Don't try this at home. We're professionals.
Yeah, we'll bring in our guest, Dr. Vineet Talwar, who is a medical oncologist. For people who don't know that, that's cancer and things of that nature. I love the medical profession. They always have a name for it, and no one will understand it except the people in the medical profession. They do that in law practice also. So it's kind of a good thing. So Dr. Talwar, tell us, where are you from?
He's muted.
He's muted? Well, why would we mute him? Let me unmute him then. Unmute. Dr. Talwar, where are you from?
You muted him again.
I did?
I'm,
That's good.
yeah, can you hear me?
Yeah, we can hear you. You're good. Where are you from?
I'm from India, from Delhi.
Delhi, okay. I was going to ask where in India because we broadcast worldwide, and of course, ANKIT is in New Delhi. So, okay, so the thing is, I just want to make sure where you're from. So what do you do? You're a medical oncologist, is that correct?
I'm a medical oncologist here at the Rajiv Gandhi Cancer Institute and Research Center. This is one of the premier institutes in northern India.
Okay.
And we are a 500-bedded hospital, and all the facilities under one roof: radiation, surgery, and chemotherapy, transplants. So we are doing everything practically.
So it's a nice size hospital then you're working at.
Yeah.
Okay, right. Are you familiar with the Fred Hutchinson Cancer Center?
Yeah.
Okay, right. I have a lot of friends who work at the Hutch and do research over there. When I used to live in Seattle, and they do a lot of work over there. So
they're doing transplants there, a lot of transplants.
Yeah, they are. As a matter of fact, they did one because of COVID-19. Now, let me ask you this: since you're an oncologist, have you seen COVID-19 affect people in the oncology area?
Yeah. In fact, in India, I don't know about the West, about 60% of the cancer patients which we are seeing, which we have diagnosed as COVID positive, they were asymptomatic.
Oh, really?
In the sense that whenever we expose them for some procedures, say if it's an endoscopy or a bronchoscopy, where you have a fear that the the patient might contaminate the whole room and might infect the person who's doing the procedure, so we do the COVID testing first.
Okay.
So in our setup, about 60% patients we found that they were asymptomatic or minimal symptoms
Right.
and COVID positive.
Wow. Okay. Yeah. For those who don't know, asymptomatic is you're running around with it, but you don't really feel it or have it, and that becomes a big problem. Now, the statistics I read, Dr. Talwar, is that if you have a pre-existing condition, let's say cancer, and you have COVID-19, the mortality rate increases tremendously. Are you seeing that also?
Actually, the behavior between a person who's COVID and person who's non-COVID, there is not much difference. But yes, you're right. There is a difference between the mortality, but not that substantial that what we have seen. In fact, in New England Journal of Medicine, there was an article regarding that, and also in the Lancet Oncology. They also, probably in the West, also feel that when you treat these people, the behavior is not much different, but of course, there is a slight difference in the mortality. You're right.
Right. Yeah. And for those who don't know, the Lancet is a very well-respected journal, and we were going over that yesterday with the people that were listening to our show. That the thing is, there's journals, there's respected journals, there are peer-reviewed articles and non-peer-reviewed articles, and see a lot of people don't know that there's a difference whether or not because anybody can go publish an article and some journal will take it, but the real question is, was it peer-reviewed, which means other people that know what they're doing have looked at it, and there's certain journals that actually have very well respected. One study I've seen from 34 different journals on ssrn.com, which is one of my favorite places to go, and I tell everybody about ssrn.com, the largest depository of academic journals in the world that no one knows about. That you'll hear it over and over again. Don't worry, Sarah. So it's ssrn.com. Now you know that masks actually mitigate the coronavirus. If you wear a mask and someone else wears a mask and you socially distance, it's like a 90% mitigation. Dr. Talwar, what is your opinion on people wearing masks, especially the N95?
No, what you're saying is absolutely right. See, three situations when I'm seeing a patient, I'm not wearing a mask, the patient is not wearing a mask. Transmission is 100%. There's no doubt.
Wow.
Situation two, when I'm wearing a mask, the patient is not wearing a mask, or vice versa. The transmission comes down, but it is about 20 to 25%. Situation three, when I'm wearing a mask and the patient is also wearing a mask, the chances of transmission comes down to less than 3 to 5%. So the best case scenario is both of us wearing masks. And, there are two kinds of masks. You have the normal 3-ply mask, which is, the conventional mask. And another one is the N95 mask, which you were mentioning.
I like the N95. I have an N95.
If you are a medical worker, if you are going to come into contact with all kind of patients, then I think then N95 should be the best.
Right. That's what I have. I have the N95. You got to have the N95. It's like flying first class. Yes, Jim. What?
I had a follow-up question for Doctor. You mentioned that the mortality rate in the oncology field, if they're COVID infected, is different, but not substantially so. But I'm wondering, is there a difference between the asymptomatic people, the people who are not demonstrating symptoms of COVID, and their survival rate, compared to the people that are having symptoms, that are actually suffering from the disease? It's manifested itself in some part of their bodies, and their survival rate. Is there a difference between the two?
Oh yeah, Jim, definitely it is. Patient who's asymptomatic, that means the viral load in the body is much, much less, and the immune system of the patient is not that impaired. Vis-a-vis another patient who has, say, pneumonitis because of lung infection, chest infection, or the patient is on oxygen, or the patient's blood pressure is not okay. If you compare these two patients, definitely the one who's asymptomatic is going to do much, much better, because the body's immune system is somehow trying to get the bearings and pull him out of the situation. So yes, there is a difference, definitely. And we have seen in our practice that patients who are COVID positive, cancer patients, and who start developing breathlessness, or there is a fall in the oxygen saturation capacity, the capacity of the body to carry oxygen,
Right.
they go down very rapidly no matter whatever you do. And if you have 100 of these patients, out of that you're able to salvage just 5 to 7, because once, as you say, as you go into the groove, it is very difficult to pull these patients out.
Right. And by the way, oxygen saturation. See, there's a little device here. You put your finger in, press the button, and it will tell you what your oxygen saturation level is. It's very important because it gets really low.
It is the most important thing.
Yes.
In fact, when we talk of asymptomatic patients, when they have, a fall in the oxygen below 90,
right,
they are the ones who are going to deteriorate vis-a-vis the other patients who have a normal oxygen saturation. So this is a soft pointer which initially can predict how the patient is going to fare when the patient, he or she, has a COVID infection. You are absolutely right.
Right. And by the way, you can buy these off the internet for like $40.
Yeah.
I know what your oxygen saturation level is, and you can actually test yourself. Well, they give an indication. And if you see this thing dropping, it's like a thermometer. You need to go see a doctor because you got.
So the watershed line in
really
this case is 90. It should not be less than 90.
Yeah. Right.
Generally, it should be about 94, 95.
Yeah.
But if it starts going down and the heart rate starts coming up, then there is a problem.
Yeah. What gets me in the United States and around the world, a lot of people aren't even familiar with this tiny little device that costs $40 that you can measure your oxygen saturation level. And, it's like a thermometer. You should have it because I think it's a very important indicator. And from what I've seen statistically, Dr. Talwar, if you wait by the time you get on a vent, your odds of survival are less than 20%. Have you seen that also as well?
Exactly. That's what I told you. A patient who's asymptomatic, whereas a patient who's on oxygen and the saturation is falling, they are the ones who are very, very tough to salvage.
Right.
Because the disease has got a stranglehold over the body.
Right.
So definitely we don't want that situation.
Right. Yeah. For those who are joining us late, this is Med Center Friday with Doctors. I'm Nick Palavita from Raleigh, Durham. We have Ankit Kandlawar from New Delhi, Jim Eade, who's actually from the Socialist Republic of San Francisco, who knows to wear a mask. Rakesh has just joined us from Hong Kong. Good to have you here. And our special guest, Dr. Vineet Talwar from New Delhi, or Delhi, which may be different than New Delhi, and Alexander Starr from Toronto. And we're here discussing Med Center Friday, the coronavirus, and how it affects oncology patients, which looks like that apparently he sees a lot of people that come in that are asymptomatic. And then, of course, he has some people that are not. And he's at a very large hospital in Delhi, correct? So tell us again about the hospital that you practice in.
I'm at Rajiv Gandhi Cancer Institute in Delhi, which is a 500-bedded hospital, and all the 3 specialties under one roof, and all the investigations, including the molecular tests which have to be done, all are done by us in-house. We don't send our samples anywhere.
Okay. All right. Great. So the thing is,
what's the situation in Delhi right now? What's your opinion on that?
Well, Delhi is, challenging Mumbai, I'll put it that way, to get the top slot.
Okay.
So you're seeing
probably, I think the
infections go up then, yeah?
Oops.
There it is.
Sir, we lost your voice. I think
he's back.
Yeah, now it's fine. Yeah, now it's fine.
Can you hear me?
Yeah, you can.
Yeah, what I was trying to say was that now we have ramped up the number of tests which we are doing. Initially, they were quite less. So we are, finding more and more cases. Fortunately, a large chunk of our patients in Delhi, as compared to the West, they are either asymptomatic or they are having a low level of viral infection and they are coming out. As you could see, it's almost 50-50. You getting 100 infected, 50 have recovered. And the other 50 out of that, about 3 to 7 are the ones who don't fare well, but The other 47 are on the path to recovery.
Okay,
That
Sarah
is
has
as far
just,
as the stats are there.
yeah, Sarah has just joined us. Sarah, where are you from? And tell us where you're from and what do you do?
I'm from Aurora, Illinois, and I am a corrections monitoring center supervisor. So,
Do you see a lot of coronavirus in the correction area? I heard that that's a big problem, that people that are in the correction institutions have a large amount of coronavirus. Are you seeing that in Aurora, Illinois?
Actually, the way that COVID has affected the correctional center is really interesting because you want to be practicing social distancing more and more and more. And when you're in any sort of correctional facility, social distancing isn't actually something that they have been implementing before this. And now that they're trying to do that, you see a lot of people going out on parole earlier than they were beforehand, which is good in a lot of ways because it gives a lot of people opportunities to get a head start on that rehabilitation process outside of the correctional facility. But in the same breath, a lot of those people, especially in the correction system, they have this mentality that's like, okay, I'm not going to get out on parole until July of 2021. So when they're out on parole in June of 2020, I think that a lot of them automatically kind of fall back into this pattern where they're like, this isn't right. I need to be in jail. Like there's a lot of recidivism that we don't typically see from people who are coming out and going on parole.
Yeah, right. And so the thing is, Dr. Talwar, do you see a lot of people that are getting coronavirus in jails and nursing homes like they do here? We tend to get a lot of the people in the correctional institution and nursing homes. Do you see that also in India?
Yeah, wherever there is clustering of people, and where unfortunately we are not able to follow the norms, the social distancing norms, which are the most paramount criteria. We find, yes, in jails also we are finding, in fact, some of the criminals in, there's a jail in Mumbai, Arthur jail, they have released them who have got, small petty charges just because of the fact that they don't want to overcrowd and cause a situation there, sudden splurge of coronavirus cases. So yes, social distancing wherever it is not feasible or wherever it is not practiced, there's a problem. And one peculiar thing is there that even in hospitals, in big hospitals, whenever the nurses or the technicians, they are working, they maintain social distancing, they wear masks and all. But when it comes to lunchtime or coffee time, unfortunately, they come and gather together and then they forget everything about the norms and all. They take out the masks, they start having tea or coffee, and they start chatting without the mask. So we have found that, the certain clusters where the infection has increased, we went, back tracing, in contact tracing, and found that that was there. So what we did was that we instructed all the staff that whenever you have to eat separately. You don't have to congregate. And once we have done for the last almost 3 to 4 weeks, we have found that the surge which was there in the positivity amongst the hospital staff, that has started petering down. So that was an observation which we made and tried to curb.
What about?
How effective is the plasma therapy right now for COVID patients who are seriously suffering, and post plasma they have recovered very well?
See, plasma therapy has been used since the last so many decades. And it is not a treatment per se, but it is an adjunct. Adjunct meaning by, like, you have the main dish and you have the side dish. So it is a kind of side dish which bolsters the immunity of the person artificially by giving the antibodies from outside, from a person who has already suffered. So you have a person who has suffered and recovered. The antibodies are taken out and they are injected into the person who is suffering. So it just boosts up the body's immune system. It is not a kind of a treatment. It's a kind of, you can say a corollary. It is not the main treatment.
Yeah.
And also, Dr. Talwar, we are getting news from China and other countries as well that they are preparing some antidotes and they are taking some blood cell from the patients who were suffering from corona and then using that antidotes to other patients. Can you share something about it? Because our viewers would like to know what is that all about? What is that process?
Yeah.
No, again, that is sensitizing the body's immune system to the virus. Because, see, why there is a problem with coronavirus, which is not there with influenza virus or any other virus, it is simply because humans have not been, coming in touch with this virus. This is the first time. So when you come in touch with a virus whose, the body's defense mechanism is not there for that virus, then the body is defenseless. So what you are trying to do is by the normal mechanism, increasing the body's immune mechanism, or by artificial means, when you give the antibodies from outside, whether you give it from plasmapheresis or whichever way. So what you are trying to do is you are going to bolster or improve the affected person's immune mechanism. Now, there are a lot of studies which are going on throughout the world, and any study to get credence, it has to be at least a phase 3 study. So a lot of studies which are going there in phase 1 or phase 2, probably, in times to come, we might, come for a good mechanism by which we can control this. And same is with the vaccines. The vaccines also, are being prepared. The problem in India is that we have around 11 kind of strains. It is not just one strain of the virus.
Yeah.
So if you make vaccine against one strain,
That's it.
then probably you might get affected by the other strain.
That was my
There is
question.
always a chance. There's about 5 to 7% chance of getting a strain from, and people might call it a relapse, but actually it won't be relapse. It would be reinfection with a different strain.
With a different
So
strain.
all these issues are there.
Right. One of the studies I read, Dr. Talwar, it said that, and Dr. Fossey, who heads our infectious disease, goes, a vaccine will be done by the end of the year. But the medical doctors I've talked to said an effective vaccine won't be done for another 2 years. So are we talking about getting a vaccine out by the end of the year, but it sounds to me, the effective vaccine is probably 2 years away because of what you just said. There's different strains of the coronavirus. Would that be correct?
Yeah, something like the cervical vaccine, which we use for the cancer of the cervix, it's a polyvalent vaccine. That means it covers 3 to 4 different strains. And these 3-4 different strains, they, are comprising of about 70% of all the viruses which cause cancer of the cervix. So when we call it an effective vaccine, then probably, it should cover 3 or 4 strains which are the commonest, and then only, you can get foothold over the disease. So like I said, if you make a vaccine against one strain, there might be another strain which might be there. That strain might come into prominence when you suppress one strain. So this may go on. So if you have a polyvalent vaccine which covers 3-4 strains, which are the maximum in that country or that place, probably that would make more sense. Yeah.
That was my question, Doctor. I was thinking, because of my software background, I was thinking of COVID-19 1.0, then you have COVID-19 2.0, and maybe COVID-19 2.5, and you can have all these different strains, and you might have a vaccine that's effective for COVID-19 1.0 through 2.0, but then you're going to get COVID 3.0, and that vaccine will not be effective.
Yeah. But the silver lining is that you are getting more and more people infected. So once it reaches a critical mass, that means about 50 to 60% of the whole of the population is infected, whether they are symptomatic or asymptomatic. Plus, we have a good vaccine. that would be the time when, the herd immunity, the so-called herd immunity will be generated, and they will take care of the virus. Like it was in polio vaccine, where, the herd immunity came over, and the herd immunity was by the fecal-oral route, the motions. So that got spread out into the society. So I think something like this, when it comes, then probably only we'll say that the version 1, 2, 3, 4 will stop
Yes.
after that.
Yeah, that's the most optimistic thing that I've heard. Thank you very much for telling me that, because I really was very concerned about the various strains. But I understand what you're saying about the herd immunity. If enough people have it and a better vaccine, that maybe one day we will move past this. So
Yeah.
I'm very grateful for
But
this.
Jim, the problem is people nowadays use herd immunity as a very loose term as of now.
I agree.
Because if you have to say herd immunity, at least 50 to 60% of the population has to be infected.
Right.
Then only, the critical mass is there and it will encompass the virus. Plus, a vaccine has to be there. If you don't have any one of these, then you cannot say, then it's a misnomer. It is not herd immunity.
Correct. I agree. Thank you very much for that. Sarah, you had a question.
Oh, thanks, Jim. Yeah. No, my question was simply, with everything that you're saying, I definitely agree with Jim. It sounds positive, but it also sounds as if this process, like Nick said, it's going to take years before we've really got a strong handle on this.
Yeah, you're right. It is not like cough and cold. You are through with it and you start going with business as usual. You might have phases, like you might have the first phase which will come up and we'll go over the top. It will peter down. Then the second phase might come after a few months, probably of a different intensity, probably of a lower intensity. You might get a third strain which might come up again. So like this, it might dilly-dally over a period of 1.5 to 2 years. But after that, once a majority of the population is infected, then, things might start settling down.
And so
So
when you say
I
that,
strongly feel 1 to 1.5 years is bound to stay, whatever the severity might be there.
so would you expect that the same sort of precautions that we have in place now, like the social distancing and the mask wearing, so we're going to see these well into the end of the year and maybe even next year?
I'm sorry, I'm not able to hear. There was some cracking
Can
of
you
the
say that
voice.
again, Sarah?
Oh,
Can
yeah.
you,
Sorry.
Ankit, you can tell me.
can you repeat again, Sarah? Because I also couldn't hear you.
No,
Can you?
what I'm asking is the precautions that we're taking now with the masks and the social distancing. Is this something that you're expecting us to be doing or expecting to see well into the rest of the year?
Good
So,
question.
Dr. Talwar, he's talking about the precaution what we are taking right now. Do we have to add any other arms on our, precaution list, or maybe do some kind of different hygiene to make sure that we protect ourselves?
Yeah.
See, as the time is passing, we are getting more and more, I should say, intelligent about the virus. Initially, what we thought was that it is only by the cough and the
Yeah.
droplets.
Mhm.
Somebody coughs at you, you get it. Then we came to know that it can get infected through the stool also when you pass motions. So the precautions which we started taking was that if a person passes motions and is probably COVID positive, then you wait for 6 to 7 minutes before using the toilet pot, because once you put the flush, there is a kind of aerosol which is generated, and that might infect. Third thing which we came to know was that this might come through tears also, or any other secretions from the body. So all these things are there, but then there is no rocket science as far as prevention is concerned. Suffice to say that you maintain social distancing, you wear your masks, and the most important thing is, whenever possible, keep on washing hands. Washing hands is much better than the sanitation which we do by sprinkling the disinfectant in the hand. If you have no other way, then of course the disinfectant is okay. But then given a choice, keep on washing your hands after 1 or 2 hours, and also maintain social distancing and wear masks. Don't let your guard down. If you do these 3 things diligently, then you have to be, awfully unlucky to catch the disease.
Doctor,
Oh,
I want to follow up on Sarah's question. And how long do you think we'll have to be doing this, washing our hands, wearing masks? Do you think it's going to be a matter of a year, 2 years? Just a rough guess, of course.
Well, Jim, this is going to be a lifestyle change. You call it a new normal, whether you like it or not. And as far as time period is concerned, I really don't know. I won't be able to answer this question.
Yes, I know it's a fair question, but I asked it.
But Jim, what I wanted to
We'll
add,
get wiser.
is
As the
that
time passes, we'll get wiser.
it's a good habit to have those, things in a lifestyle. Wash your hands, keep yourself secure, keep a physical distance, keep a social distance. That's a good habit. So if we follow that habit, it's good for us. Maybe today is COVID, maybe tomorrow is something else. So we will be protecting ourselves from those kind of viruses.
That's true.
I mean, it is such a paradox, In Delhi, we had terrible pollution. The AQI, that is the quality index, the air quality index was going up to 600, 700.
Oh my gosh.
And we were having air filters in the house and so much pollution. Now the AQI is about 70, 80. And
wow.
now we are wearing masks.
Yeah.
we are not venturing out. It's a
my
total
God.
paradox.
And also, Dr. Talwar, on the other hand, all the birds and animals, they're happy that we are not going out and there is no pollution. So they also find their own.
They are having a ball of a time.
The animals are happier. I did have another question. It's a slightly off topic, but because I was born in the divided states of America, I was familiar with Canada and Mexico, and I wasn't so familiar with India. And when you say Delhi and New Delhi, are you talking about different neighborhoods in the same city, or are you talking about two physically different cities?
See, when you say New Delhi, there is a small area inside Delhi, that is the Lutyens Delhi. And around that you have Delhi. So when you say New Delhi or Delhi, you are basically meaning Delhi. New Delhi is a kind of enclave inside Delhi, because Delhi is growing daily. You had Delhi, now you have the National Capital Region, NCR area. So figuratively, if you say Delhi or you say New Delhi, it is just the same. There might be a change in the postal code, but then Delhi is the generic term which we use.
And Jim, to add on what Dr. Talwar said, we have Old Delhi as well. We have Central Delhi, we have North Delhi, South Delhi, East Delhi, West Delhi.
So these are neighborhoods really in the same geographical place.
So, so Delhi was like this earlier. Now it's growing like this. So we are adding more names to it.
Got it. Yeah, we have neighborhoods in San Francisco that have different names as well. You can live in Dog Patch or Nob Hill, or So and if you live in San Francisco, you don't say I'm from San Francisco. I'm from Pacific Heights.
But Jim, you know that if you talk about National Capital Region, which is Delhi and some other cities from some other states, if you talk about population, it's more than some of the countries we have with less population.
I see.
So that it's totally densely crowded, and a lot of people who comes to work in Delhi as well, and that's how Delhi is growing and expanding their wings, and that's why we have more cases in Delhi and Bombay as compared to the rest of the country.
Yeah, of course. And people come to find work, and then you grow, and then you have the population problems. It's an old story.
Also, I'm getting a question from Africa, and one of our viewers would like to know that what kind of precautions doctors are following during the pandemic.
Oh, yeah. Well, I think the N95 masks, I'm going to speak as though I'm a doctor, but I just play one on TV. There you go.
So, Dr. Talwar, that question is for you from one of our viewers from Africa, and he wants to know that how you're protecting yourself, because every day things are changing in Delhi, and there's a lot of cases going around. So what kind of precautions you are taking for your family and for yourself?
Oh, good question.
No, see, What I'll put it, the way I'll put it is that I don't make an extreme machine of myself, but at the same
Ooh.
time, I don't let off my guard. Whatever I've been practicing 3 months back, the same thing I'm doing it religiously. And simple things at home. When I come back, I take off my shoes outside the house. I don't bring them inside. Inside, I have my other slippers which are there.
Yeah.
So half of the filth which is there, that is taken out. Then the other thing which I never used to do, I'm doing it nowadays. I straight away go to the bathroom and take off my clothes and wash my clothes myself.
Okay.
Because after you have washed the clothes which have been soaked in hot water for about 30 minutes, the
Yeah.
chance of they being virulent with the virus are very, very less. It is never zero.
Okay.
So that is another thing I do. And after that, I keep on washing my hands every 2 hourly. And I have my mother there who's elderly. She's about 80 years old. So given a choice, I don't come in too much physical contact with her, but we keep on talking at some distance.
Okay.
And I try to practice a healthy lifestyle. I try to, because we keep on getting calls in the night. We sleep in between the calls. And I try to eat nutritious food. I try to do some exercise at home. I've got a treadmill. So 10-15 minutes in the morning, 10-15 minutes in the evening. I try to regimentalize, but then sometimes I slip. But then, doctors are humans first.
Yes.
So these things I have not let down for the last 3 months.
A tip of the hat.
So
to
that
you,
is that is how I do it.
I have to tip my hat. to you.
Dr. Talwar, we have Dr. Rajat Gupta joining us from Delhi. And Dr. Rajat, good evening and welcome to IBMTV Med Friday. And we have Dr. Talwar from Rajiv Gandhi Cancer Institute. And we were discussing about the current issues, what's happening in Delhi. What's your take on that?
Hello, sir. Good evening. Hi, Ankit.
Maji, good evening.
Hello, everyone.
Yeah.
So, the current take on the current pandemic is that the number of cases are increasing because, as per the central government, they are increasing the number of testings. So, definitely, we are going to get more cases. But we are living with it. So, people are less scared now. I see a lot of people out on roads. So, we are living with COVID. So I think Sir has summed up all the necessary precautions we need to take as individuals. So I guess more or less everybody is doing that. So rest is luck. So whatever happens will happen. So we have to live with it.
And Dr. Talwar, before you leave, I have a last question from you. That how important is the zinc to take it at this point of time, to consume it, to make sure you have built up some kind of immunity with the zinc tablets? Would you subscribe that tablet?
There are studies which show that zinc has some benefit, not directly but indirectly. Along with that, vitamin C is there. So our COVID patients, whenever they get discharged, we give them a B complex. And nowadays we have certain B complexes which are combined with zinc. I won't tell the brand name because otherwise, it will get outside the chemist shop within no time. And so you have zinc alone or zinc with B complex, then you have vitamin C. And the other things which, I told, a healthy lifestyle and a regimentalized, you have good sleep, you have good food, try to do a little bit of exercise. I think
I've heard a lot about vitamin D3 in terms of immunity. What do you think? Yeah.
You're right. Vitamin D also, there are certain studies, and vitamin D can be given once a week for about 4-5 weeks, and after that it can be given once a month for another 4 months. And it is,
so not daily.
it is supposed to boost up the immunity. In fact, both vitamin C, D, and B complex with zinc, they can be given safely.
I take it daily. Is that too often?
Yeah, I take it daily too. Should I be concerned?
Pardon?
D3. We take it daily, Sarah and I. Is that too often?
D3 should not be taken daily because, unlike vitamin C is basically a water soluble vitamin. You take even a kilogram, whatever the body requires, it will consume and rest will go out in your urine.
Right.
Vitamin D is not water soluble, it is fat soluble. It will stick around in the body and it can cause hypervitaminosis, a condition in which it might act the other way around. So one has to be careful with vitamin D. You take it on a weekly basis, don't take it on a daily basis, and after some time you have to take it on a monthly basis. And
How do we
in
know that's
between, if
happening?
possible,
I feel it now too.
this is not to scare you. You can get the vitamin D levels checked in between, and if they are normal, then probably you can stop for a while and then restart it later on. But vitamin C you can take, B you can take, because B and C are water soluble.
Yes.
So it can go outside the body, whatever the body does not require. D is a totally different issue.
Okay. Thank you so much for that information.
Yeah, no, really, thank you very much for that information.
Okay. So I think I'll take leave. It was
Sure.
lovely
Thank you.
chatting with all of you.
Namaste.
And thank you so much.
Looking forward to host
Thank
you
you.
again whenever you are available. Thank you, sir.
Sure,
And
sure,
thank
sure,
you for
sure.
helping us out
It'll be-
during the pandemic.
It'll be my pleasure. Thanks a lot.
Take care.
Thank you.
Thank you.
Bye. Bye.